Hello everyone, welcome back to my channel. Welcome to Pharmacology Difficult Podcast. And today we are going to start a very small series of few episodes, just 3 or 4 episodes. And this is gonna be in context of the World TB Day, which is approaching on 24th of March. So I just wanna divide into different aspects of covering this topic TB, that is tuberculosis. And the first topic that we're going to take up today is that what are the factors which are responsible that we are dealing with tuberculosis disease in present day. Why does the tuberculosis exist in 2026? It's a very interesting, very important point, and we should be really thinking about it. So without any delay, let's get on to our topic of the day. The present era is an era of modern medicine. Very highly developed technology, highly developed and sophisticated diagnostic tools, and a lot of modern things developing day by day, and a lot of progress going on in the field of medicine. But still, the tuberculosis prevails. It affects millions of people every year, and it doesn't fade away. Why is it like that? Let's think about it. The first and the foremost reason is that tuberculosis disease, it spreads very easily through air, through the airborne droplets. It is caused by a bacterium, Mycobacterium tuberculosis. This bacterium spreads through the airborne droplets by very simple means. Even if infected person coughs, sneezes, speaks even, then also the other person can catch the infection. It is so easy. And especially when people are living in very crowded, low-aired spaces and places, the ventilation is not poor, unhygienic conditions, the infection, it spreads rapidly. So you might have heard and noticed through a lot of research is going on that TB is very, very common in densely populated areas. Not in sparsely populated, but in densely populated areas. Another important reason TB never fades away because there is something which we call as latent infection. It prevails even after the symptoms and signs are gone. It persists, the disease persists in latent infection. A person can carry the TB bacterium and the person won't even show any signs and symptoms. Nobody gets to know about it. And that is what we call latent tuberculosis infection. And you know what? This bacteria, Mycobacterium tuberculosis, it can remain dormant in a person for years. Yes. And if the immunity goes down of that particular person, then this infection, it doesn't stay latent, it becomes quite active. And this is kind of a hidden TB, something which is deceptive. And because of this deception, it never fades away. It's very difficult to eliminate this particular disease completely. We cannot eradicate it totally. That is the biggest challenge. Let's come to the next reason why TB is so common and so difficult to just fade away. Because the treatment is also very long. If a treatment of a person infected from TB, it starts, it goes on long and long, and it's quite complex also. If you try to understand, when I'll be discussing the treatment and the drugs and the whole regimes, you'll get to know how complicated it is all. It requires the person not to take a single drug, but multiple drugs for a very long period of time. You know what? The typical therapy, it lasts for 6 months or longer. It is so painful, so arduous therapy. And okay, vigilant people do maintain this therapy for a long period of time, but what about the illiterate people? What about the non-vigilant people? Careless people? They're not following, they're not adhering to the guidelines for such a long period of time, like 6 months. The attitude is, who cares? What happened? Nothing gonna happen. And that is why it is so difficult to eradicate this tuberculosis completely. I hope you are able to understand this point. It's very important. And now in today's era, the next important challenge which we all are facing so importantly and evidently is the drug resistance. TB is also modified as a drug-resistant tuberculosis disease. Now the TB bacterium has become resistant to very commonly used drugs like isoniazid, rifampicin. And that particular time, the infection is so difficult to treat, I tell you, it is damn hard to treat. That's what we define as MDR-TB, multi-drug resistant tuberculosis. And you know what? It requires a longer treatment, complex treatment, and the drugs used, they have toxic regimens also. Side effects are severe. The person is suffering grows much beyond what you can ever expect and think of. So now you're understanding the complexity and the difficulty that is arising in the treatment of the TB infection. Next important and very true point is that social and economic factors, they are also affecting the complexity, the difficulties and the challenges of this infection of tuberculosis. Tuberculosis, it prevails in poverty. There are so many factors that increase the risk of TB infection. What are these factors? Let us count them one by one. Dense population, overcrowdedness, malnutrition, poor nutrition, poverty, and people having a very limited access to healthcare. Because of the place they are living or because of their financial condition, they are not able to get the proper healthcare what they require and they should get actually. And the diagnosis is delayed because of their carelessness, because of their illiteracy. And these are the social factors, the financial factors that actually prevent the healthcare bodies to work upon this infection properly. It is so challenging that we cannot eradicate this infection completely from the globe. It's really a big problem. It's really a sad problem which one should ponder over. Next, and in this particular context, today's last important point, the immunity is weak for many people. And when the immunity is weak for many people become very susceptible to tuberculosis infection because they are not properly fed. They are very weak inside. Their bodies are not able to fight the disease back. There are many conditions. There are many overlapping diseases like HIV, AIDS, diabetes, malnutrition, and sometimes certain treatments, some kind of therapies, they make the immune system go so down that the person actually catches the infection very easily. Tuberculosis secondary infection. And even sometimes the latent tuberculosis, it becomes active. These are also big important challenges. People are just ignoring around. But they should be very well paid heed to. As being healthcare people, we should be very aware of all these things. Immunity is compromised totally in such conditions. And the people are not able to fight back the infection. They are struggling. They are dying with this infection. So what do you say? Do we lack the treatment? Don't we have the modern therapies? Don't we have the diagnostic tools? Don't we have the best of the techniques? We do have. We have everything. In today's modern world, we have everything. But the social challenges, the financial problems, the illiteracy, ignorance, carelessness, malnutrition, dense population, biological factors, social factors, healthcare challenges, they all make so difficult for us to empower and get over this infection and eradicate it completely from this globe. It is so difficult to fight against all these factors. But do we have any good news? Is there something good or everything is negative in this particular aspect? No, we have a good news. Tuberculosis can be prevented. It can be treated with proper early diagnosis, proper treatment, awareness, and strong healthcare systems and needs. If the person gets all these things and the person is aware enough, the person is ready to be taking all this healthcare help and medical help, the person can really prevent and fight back this disease very nicely in a proper manner. So what do you think? What is the aim of this whole talk and the video that I have created? In the context of the World Tuberculosis Day, the TB Day, it is our utmost responsibility and duty that we spread the awareness, encourage early treatment, discourage carelessness, ignorance, illiteracy, poverty, and all these efforts, small efforts, can actually make a huge difference. A really big leap it can take. Thank you for listening to me on this particular context of World Tuberculosis Day. If you find this video useful, don't forget to hit the like button. Don't forget to subscribe to my channel. Stay tuned for more such important, informative and awareness videos about World TB Day coming very soon on my channel, one after the other. Till the next time, thank you, take care, bye-bye.